concerns about hand sanitizers and antibiotics. Taking a scorched earth approach to getting rid of pathogens, but then it wipes out your native and healthy bacterial populations. Is that valid?
Right. I'll let that be a tough handle that one.
Closer to mic.
Closer to the mic.
They created Parkinson in mice with fecal mass on Parkinson patient. And now they believe that the bacteria in the intestine is ready to play as the first step in Alzheimer's and Parkinson disease. This is very new research. You're very right with the antibiotics. We kill a lot of bacteria and they need 6 months sometimes to recover. That's why you need to be very careful when you treat somebody with antibiotics. If it's absolutely necessary, yes, if it's life-saving. But now we prescribe far more antibiotics than any other times in life. That's why this is very futuristic question that we need to approach slowly. The GI people don't involve very much with the bacteria. We don't know very much about this. That's why I need some new research in this area.
But certainly bacterial overgrowth in the gut can affect how effective levodopa is. So on the reverse side, sometimes that can be evaluated by a biopsy by the GI doctors to see if that's the case. So in certain cases where levodopa's effectiveness has changed, we may evaluate that. And on the same side, we need beneficial bacteria to help the medicines get absorbed, broken down, food broken down and absorbed. So it's a balancing between overgrowth, which is bad, and necessary bacteria, which are good.
In the States, we have no good habits to eat good food for fiber for bacteria. Bacteria eat fiber. Remember everybody. Fiber, fiber, fiber. And every country has some kind of bacteria. In Germany, they have the sauerkraut. In Bulgaria, I'm from Bulgaria, we have the so-called very good acid, the bacteria is called Acidophilus bulgaricus. It's not called Acidophilus in Greece or something like that. This is a good bacteria that we can find in HB, in the special milk session there. It's called white lung. This is if everybody, all my patients are addicted to this yogurt. They are very healthy because the immune system is 85% in the belly. That's why if you have time, you check it. There's no sugar inside. That I half of my patient is programmed to adapt to this bigger test, but once they are adapted, they are addicted forever.
Next question.
In the spirit of good humor and good mental health, I took Dr. Garcia's test the other day, and I wanted a serial killer oil thing. But can I get a prescription? Since my wife is here, that I need to play more golf.
We'll see about that. Next question.
Hold on.
I'll repeat it. So the question is whether there's a problem doing coconut oil with your Parkinson medicines anymore. Karen.
I didn't see any documentation on. I know there's evidence with Alzheimer's. I haven't seen the documentation, the evidence on coconut oil for Parkinson's disorders. But is that? I'm not sure if I'm missing something.
There shouldn't be a problem taking your medicines with it. But I think that was the question.
It was it's more the protein.
Yeah, it's the
amino
protein
acids.
amino acids for patients who find that their levodopa after a meal isn't kicking in. They may want to redistribute their protein around their medication times. Yeah, but that would be the amino acids, the protein, not the fats.
I'm also just back from a meeting where the microbiome and the bacteria of the gut, protecting that is so important. A lot of the additives and emulsifiers like maltodextrin, that's the bulking agent in so many things, is increasing the sticky biofilm and doing away with making the gut more leaky. So I think that's definitely something, if you can eat more naturally and less processed foods, that would probably be really good for all of us. Another thing just to consider, making sure you're getting enough vitamin D. That is something that it's not just a vitamin, it's a hormone. It's part of your cholesterol synthesis and your hormones. So it also has to do with metabolic syndrome and makes you more insulin sensitive if you are making sure your vitamin D levels are good, which we used to say vitamin D is the sunshine vitamin. There's no dietary requirement, but apparently there is now because with just changes in the environment. I'm seeing very many people that have low vitamin D stores that work outside on the weekends and spend time outdoors, but there's still it's still important. And also calcium in trying to maintain your bone mineral density, making sure you're getting enough calcium, and the actual citrate doesn't suppress your gastric acid. So that's probably going to be the version if you're supplementing with a supplement, the calcium citrate. It's also not constipating.
Next question.
Yeah, 2 questions if I could. When you take a carbidopa and it's in an oral dissolvable tablet form, is it less likely to be in competition with amino acids? My other question is, Sarah King has the gut diet, and she recommends the fluid with apple cider vinegar and lemon juice. What does it do to drink that 3 times a day?
So I'll handle the first question, and then I'll project the second question to the panel member. So most patients eventually require treatment with carbidopa-levodopa. Carbidopa is merely the component that prevents side effects. Carbidopa doesn't get into the brain. You need to have about 75 to 100 milligrams of carbidopa each day to prevent side effects, which include dizziness, nausea, lightheadedness from the levodopa. And so carbidopa doesn't have any positive or negative effects. It's there to help prevent side effects. So the levodopa, whether it's in a tablet form that you swallow or dissolves in the mouth, doesn't change its effectiveness. It doesn't make it faster acting, doesn't make it better absorbed. The problem with the dissolving tablet for some patients is it never gets down, okay, because it stays in the back of the mouth, or it doesn't come down, especially if you're not drinking a lot of fluids, because of the dysmotility in the mouth and the pharynx and the esophagus that can happen in Parkinson's disease. So while it's convenient, it doesn't have any benefits over swallowing the tablet. So, and whether it's dissolved or tablet form, once it gets to the intestine, that's where it's absorbed. So nothing happens in the mouth. Okay. So the second question was the vinegar, and I don't know anything about that, so I'll let Karen.
People ask me all the time and are promoting the alkaline waters, but your body is very efficient at managing your pH between a very narrow livable range, and your breathing, your urine output, your gastric acid, a lot of changes take place in the body to make that happen for you, that we don't have to think about that so much. But the interesting thing is that while people are drinking alkaline water, the apple cider vinegar and lemon, the citrus juices have an alkalizing effect in the body. So even though they're acids, they have that impact. It's a little hard to take them as they are. People mix them with stevia or something to make them, because I tried, doing a thimble full of it, or just putting it in my water. I was like, I got a lot of water and it all tastes really bad. So finding a way to take it that's acceptable, if that's what you're trying to do, I hope if you have tips on how to make that delicious, let me know. But,
She's wanting to know if the Parkinson's affects,
Hold on, you got one.
oh, yes, I was wondering about, in your opinion, what do you think about stem cell? And I understand that for some patients, they do, that some qualify and some don't. So, like doing stem cell like in the brain for deep brain stimulation. What are your opinions on that?
Yeah. So the question regards the utility of stem cells and deep brain stimulation for Parkinson's, I'm assuming. So we'll handle the first question. So, right? Yeah. So, first of all, what is a stem cell? A stem cell is a cell that doesn't do anything. A stem cell has to convert or be converted into something else. So a stem cell can be converted into a heart tissue or a neuron or a cell that supports neurons or that bathes neurons. There are many things a stem cell can turn into. So first of all, a stem cell by itself has no utility in Parkinson's disease unless it is converted to a dopamine-producing cell or a cell that supports those cells. And it has no utility in your vein if it's infused in the vein. It has to make connections in the brain, the dopamine cell that we saw, it has to make connections to where dopamine has to act. So right now, the data for stem cells in Parkinson's disease is at a research level. It's in phase 2 trials. So that means they're just evaluating the amount of cells that have to be put into the brain surgically in order to have an effect in an open label fashion. Then they establish an amount of cells, and then they'll compare it to placebo in a phase 3 trial. So right now, anything you see offering stem cells by vein in California or Mexico or South Korea is speculative, theoretical, and expensive, and likely not useful. And remember, 30% response to placebo has a beneficial response. So that, I would say, is interesting to follow, but not yet applicable to any patient with a neurodegenerative disease. So I think that's pretty clear. I've said that before. So DBS, I'm going to let Dr. Alvarez comment.
Well, unlike stem cell, that's like Dr. Pepper said, expensive, speculative, and unless you want to go to Korea and say, okay, the treatment didn't work, but hey, I got to eat Korean food in Korea for travel. DBS is different. It's not speculative. It's actually FDA approved. It's proven. We've been doing it in America for almost 20 years, and the research started early 1900s, so we have a lot of data. It is an actual standard care of treatment, and it's not research only.
Next
what
question.
are the qualifications for that?
So for deep brain stimulation?
Yeah, for deep brain. What are the requirements of qualifications?
All right, whether it's for Parkinson's disease or for essential tremor, obviously the patient should have symptoms that are not only annoying or worrisome, but it affects the quality of their life or it's disabling to them for their day-to-day activities. So to make it easier for you to understand, let's go back to essential tremor first. We do have some FDA-approved treatment. If patients cannot tolerate the meds because of side effect, or they have to take gallon-sized amount of medication to just get the amount that they need for the day, they can consider deep brain stimulation surgery. And of course, there are some qualifications such as your cardiologist clear you, and that's a different totally subject. Going to Parkinson's disease is the same thing. Patients should have multiple symptoms or symptoms that respond to oral medications, but medications have side effect or they have to take multiple doses a day to get the relief. The most important thing with Parkinson's disease is realistic expectation. I find that this is more important to explain to our Parkinson patients more so than our essential tremor patient. Maybe because our Parkinson patients have multiple symptoms and our essential tremor patients just have shaky hands. So Parkinson patients, all of them want to have improvement of their fatigue, be strong without exercising, speak faster without seeing Jenna. That's not going to happen with DBS, so realistic expectation is very, very important. And your doctor can talk to you more one-on-one when you see them in the clinic for more, because, you know, Parkinson's disease is a snowflake. You cannot compare yourself to a guy next to you on the table.
I agree with Dr. Alvarez. I would add, just for my patients, there are really just a few reasons I send people for DBS. One, the tremor is not responsive to medicine, or the effect isn't well enough to allow the patient to have quality of life. Two, the medicine, it works but wears off and then kicks in and wears off, and you're not able to smooth that out. And thirdly, the patient has extra movements, the twisting and turning movements. In order to get the benefit of the medicine, they're having those extra movements in response. And so the benefit, the side effects are outweighing the benefits, and so DBS can be useful in those three instances, at least for my patient population.
Yes, and if you'd like to have a discussion with somebody who's actually had DBS surgery, it's different for everybody, and it's not appropriate for everybody. But I've had DBS surgery, and I can talk to you about it.
Right. So any patient who's planning to consider that, we, Dr. Alvarez and I always make sure that they can speak to a patient who's agreed to be able to talk about the patient perspective of the DBS. And the other elements is to visit with the neurosurgeon and with Dr. Bartman, and then Mike Garcia, Dr. Garcia, to do an in-depth evaluation of memory and thinking function. So those would be the steps in addition to talking to Dr. Alvarez or myself. Okay, we're going to move on to the next set of slides and we'll get back to questions. So I mentioned earlier that with obesity, the places in the brain where dopamine can act the way we want it to is reduced. And so there's a very real reason not only to stay on the fitness side of the arc that we talked about, but a very good reason for Parkinson patients to have a more normal body weight is because it reduces the places in the brain that dopamine can act where we want it to act. So we're going to give you some strategies for losing weight. So we can't lose weight without the combination of changing our diet and burning more calories. Because remember, you take in more than you burn, it's stored as fat. So we have to balance out intake and output. But you can't lose weight just exercising, especially at ages of most of us here in the room. We have to affect diet in addition to exercise. As Karen has said, the first step is eating real food, okay? So real food is something you could hunt or something you could grow. If it doesn't fall in those two categories, you shouldn't eat it. So the Twinkies, the cupcakes aren't out in any garden or any farm. So those should not be part of your diet. Hunger control is a key feature of weight control. It's not an obstacle. It's a feature. You need to understand and take control of hunger. And hunger is important. We have it for a reason. It causes you to eat when you need to maintain nutrition and energy for your functions. Appetite is influenced by your fat-free mass. That is muscle, bone, and organs. And it's the fat-free mass that sets the resting metabolism rate. That's the normal rate of metabolism, the fat-free. When there's fat, excess fat, it abnormally affects your appetite. Hunger is a signal that lets you know you haven't eaten enough to maintain your functioning, but when we have excess fat, that whole system is abnormal and then affects your ability to control, to lessen your weight and lower your weight. So we're going to talk about a few strategies. It's important to recognize there's different kinds of eating. There's eating for sustenance, to maintain the function of your body and stay healthy. And then there's eating for pleasure. And most of the audience might eat for pleasure in addition to eating for sustenance. It's getting control of that hedonic eating that's important to lose weight. Because most people choose a short-term reward, that cookie or whatever we ate for dessert today, over a long-term goal. That's important to recognize. And hedonic eating occurs more likely situationally than not. So if you're dining in a group, it's found that you'll likely eat 236 more calories on average. If you don't sleep enough, you're likely to eat 300 more calories in a day. If you're at a buffet and have all those types of food, you're likely to eat more because you also think, I gotta get my money's worth. I paid $40 and I need to try everything. If it comes in a bigger portion, supersize, Burger King or McDonald's or whatever, they're 20% more calories. If you're distracted, like sitting in front of the TV, you're likely to eat 76% more food. Yes. And there are other things. These aren't the total list, but if you're happy, if you're stressed, if you're eating with alcohol, or just because it's there, sometimes causes hedonic eating. And it's important to recognize this. So let's talk about what happens when we focus on hedonic eating. So the body gains fat. Like we said, you're taking in too many calories, it's stored, or the glycemic index is high, and the insulin is released, clears that glucose, stores it in fat. So your body gains fat. Remember I said your appetite is governed by your lean mass. But now we're building fat, and as you build fat, you develop a resistance to the feedback loop of hunger and satiety. So your brain and all other components of appetite control are disrupted. The leaner you are, the lower your fat mass, that inhibits appetite. So actually being leaner causes less appetite than being overweight. It's important to recognize that. So the body becomes less sensitive to the powerful appetite regulating hormones. There are two main kinds: leptin, that's in the fat cells, and insulin that comes out of the pancreas. So as we set up this abnormal suppression, these two things are released less, and released more, and we become resistant to the effects of those. So the appetite, hunger suppression is disrupted. And this is what people say when their glandular reason for being unable to lose weight. Glandular is something you've done to yourself, unless you have a thyroid problem. All right, so whenever someone tells me it's glandular, that's what I think about. Okay? So keep that in mind. All right, so let's give you some strategies for losing weight. So you need to establish a defensive perimeter. Keep temptation off the premises. So what do I ask you when you're in my clinic? Okay, what do you eat? And then they say, oh, I ate chicken and I have broccoli. And then I say, all right, so what do you snack on? The patient looks at the spouse, and the spouse looks at me, and we know what the answer is going to be. So it's cookies, it's ice cream. You know you're not strong enough to buy it and not eat it. Doesn't make any sense. Why would you buy it and think you're not going to eat it? So you have to have a defensive perimeter. Keep temptation off the perimeter, out of the house. And don't fetishize your foods. You got to outsmart your taste buds. So, you know, if you have a taste for ice cream, perhaps you're going to change it over to cottage cheese or Greek yogurt or something that is more appropriate. So try to outsmart your taste buds. Distract yourself, but not with TV, because remember that's 76% more food. You need a behavioral substitution. So rather than reaching for that kind of ice cream at night, go take a walk or have a conversation, learn a new language, do a mind game. Whenever that hunger feeling comes up and you're just eating for hedonic reasons, you need to distract yourself with something else. And ask, am I really hungry? Sometimes we eat, you're not even hungry, you're just wanting to do something. So distract yourself, change the behavior. So, I know my vegan friends are not going to like this section, but beef up your offense. So if you eat protein, and protein doesn't have to come from meat, it can come from other components, but protein is a very effective way to reduce feelings of hunger, because protein in whatever form, doesn't have to be animal form, increases peptide YY and decreases ghrelin. These are things that make you feel satisfied, so you're not hungry. So that could be other forms, and it's good to have a protein-filled breakfast, whether that be eggs or other component, because protein causes you to feel less hungry. You have that lack of hungry feeling. Now, here is a list of other foods that result in you feeling full. Eggs, we've said, as protein. Miso soup, asparagus. I love lentils. Lentils is an amazing food. High amount of protein, makes you feel full. Beef, I'm sorry, vegans. Oatmeal, I eat a lot of oatmeal. That's the first thing I eat in the morning, and it makes me feel full all day. Steel-cut oatmeal is very high in fiber, a good carbohydrate, and it makes you feel full. I mentioned cottage cheese, Brussels sprouts, shrimp. All are some kinds of foods that fill you up and are reasonably healthy. All right, so we'll take questions, and maybe Karen, you might want to comment on some of my beliefs. Disagree. So.
I do have a tip. There's a recipe on, it's called theyummylife.com for steel-cut oats in the slow cooker or crock pot. So it's kind of nice. You can put apples in them, and then you wake up to a delicious smell of cinnamon and apples in the house with your crock pot, steel-cut oatmeal, and it's delicious. Have it when you have company, and then you can portion it to have during the rest of the week.
Oh boy, here we go. Time for personal testimonies. Because I never related to people with weight problems when I was younger, because I didn't have one ever until I got in my late 30s, and I gained 50 pounds. So I attribute that to being in management, which, you know, I learned real quick and got out of that. So, but I find what helps me is to budget my calories, no matter what app you use. It's helped me tremendously. We budget our money on a monthly, or we should anyway. So why not budget our calories? If I know if I eat this, I only have this much left for the day. And you find that again, this is not my scope of practice, but when you're eating the greens and the vegetables and all the things Dr. Packard has listed, that goes along. You can eat a lot of that and still not have your budget. So, you know, that way, if you do eat something that's not the best choice, you're still okay. But that's just what works for me. I use the Weight Watchers app, and I'll let Karen talk about different apps maybe if she believes in those. But for me, I need that tool. I need that in my life to keep track of things, because otherwise I kind of go overboard.
Can you give that tool to Jenna?
Oh, be quiet. She has a baby in her tummy.
Heathenist, Tony.
We got a question over here.
Other questions?
This relates to your previous presentation about gastroparesis and what you suggest to deal with that, ubiquitous bloating and easy filling.
Yes, more frequent, smaller meals. Also make sure that that you're not swallowing air. Some patients have air swallowing that's taking up additional volume in their stomach. Lower fat meals are going to empty more quickly. So more frequent smaller meals, like 7 a day, rather than eating 3 larger meals, may be helpful. Water between your meals may also be helpful.
Over here.
I have a question. A new prescription was given to my husband this week, and it's called Rasagiline. And on the handout from the pharmacy, it says there's a list of foods you should avoid if you're taking that medication. Can you help me with that?
Right. It's Rasagiline. So Rasagiline is an MAO-B inhibitor. So it inhibits an enzyme that breaks down dopamine in the brain. So it's very commonly utilized. It's been around for a long time. So there are 2 types of MAO inhibitors. MAO-B, which is Rasagiline, MAO-A, which is some antidepressants, which are really no longer used. So those dietary warnings apply to the type A, but the pharmacy still hands out those warnings, not understanding that it doesn't apply to type B. So you don't really have to worry about that. Yeah.
The type A are more for the Huntington's with the tyramine, or not the tyrosine, the H cheeses, little words, overripe foods.
So if you're taking a medicine that inhibits type A, which is in the gut, then you have to avoid those types of food that were mentioned that have a high tyramine component. But for the type B, there isn't an issue. Unless you're just like eating fava beans and Chianti wine nonstop. Next.
Yes, thank you first and lastly for all this wonderful information, kind of overwhelming, but awesome. You answered almost every question I had. I'm a caregiver. So, a few questions I have. Is this being recorded so I can take it back home if my mom couldn't be here?
It's being recorded, and I'm also going to put the slide deck on the website. So both things, you can be able to watch it and go through the slide deck in a PDF format.
All right, thank you. Perfect. Kind of a strange question, but for an otherwise healthy person with just Parkinson's, does Parkinson's kill you?
So Parkinson's is associated with a decreased lifespan, but it isn't the cause of death, although you'll hear that on the news, so-and-so died of Parkinson's. The insult, which results in loss of life, is usually a secondary complication, a fall, and they bleed in the brain and it causes death, or an infection. Skin breaks down and you get infection in the blood, or a urinary tract infection goes to the brain. They aspirate food into their lungs, they get a pneumonia. So while Parkinson's is the reason they are susceptible, maybe perhaps, to the aspiration pneumonia, it isn't the cause of death, such as it is in Lou Gehrig's disease, where the respiratory muscles will fail.
I didn't like the word kill. I didn't think of it.
Next question.
Right over here.
I just want to second that other lady's comment. We do want to say thank you very much for y'all being available to ask these questions. This is a golden opportunity that if other doctors aren't doing it, they definitely should. So thank you. My question is, if I take my medication and then I exercise strenuously and I feel depleted, like my dopamine's used up, is there an explanation for that? And then my last question is, are there resources for people that may not have a lot of money or be able to go to a wonderful doctor like yourself or others that don't
Tony
have as good
answer
care?
the last question first. So
That's
resources.
the whole reason we started SA Moves is a lot of the other organizations, the money goes towards organizing the organizations. As you can tell, these great people give up their time. They're here on their Saturday and they're doing it for gratis. and the board that's here is for gratis. So the money that we raise, and Corey I found all this to Corey, we put into help pay for your boxing program if you can't do it, if you can't get to the doctor. You just need to reach out to us, and we'll try to support you in any way we can.
And if I may add, Tony, so free exercise classes for Parkinson's. We started Bernie, Franklin Park in Bernie has every Wednesday from 10 to 11, free exercise class for Parkinson's using the Think Big. Alamo Heights, Franklin Park is every Monday from 11 to 12, free. It's once a week, but again, it helps to add with your routine and physical activity. And of course, we have the Parkinson's Outreach Program, which we missed earlier. It's Thousand Oaks, Warm Springs. It's Monday, Wednesday, Friday. And then we also have from 12 to 1, and we have Medical Center, Warm Springs, from 12 to 1, 11 to 12 at the Medical Center, and then also one Westover Hills. We also have exercise classes as a group.
And those programs, well, they vary a little bit. In general, they're $50 a month. But again, as Tony said, if that is not something that you're able to come up with in your budget, then talk to Tony, because SA Booths could help with that as well. So.
Next, the mental health side of the question. So, mental health resources in San Antonio, people that you can talk to help you integrate all these wonderful things that you're learning about here within your real space. The St. Mary's Family Life Center offers sliding scale psychotherapy to at a very minimum $5 a session, and Our Lady of the Lake University has a similar program. The people who would be seeing you are students, but they're supervised by licensed clinical supervisors and professors there. They actually provide some really wonderful services.
Another resource, Our Lady of the Lake has a speech program, and they do offer a clinic. I don't know if it's sliding scale or if it's completely free, but again, you are seen by students with supervision. So that's another resource and option. I know that I'm pretty sure it's based on income, so if truly it is a problem for you,